We've got full resources here. We take advantage of our geography, Toronto being a great place to work, and many of our students say this is the place to be in healthcare in the country and in the world. The biggest challenge in healthcare right now is how do we get as much care and good quality care for the dollars we're spending. Now, most people don't realize this. Healthcare represents $200 billion of spending in Canada. It's the biggest industry in the country, and it's the biggest industry in virtually every country. 12 years ago, the business school made a decision, unlike most business schools in North America, to say healthcare is the biggest industry in all of North America. And we would be crazy not to be taking advantage of our geographic advantage, and that is Toronto. Toronto, with Boston and New York, represents one of the 3 major healthcare cities in the world. So we take advantage of that. We've recruited a half a dozen faculty who specialize in the area from across a variety of specialties. We have other faculty working with us, and we've worked really hard to work with industry in the public side and the private side that develop relationships that don't exist anywhere else in North America. We've been working a lot around performance improvement, getting more value for the customer or the patient, so we have to understand what they care about. We've been doing work around design, operations management, and increasingly, as dollars in every country become more precious, we've been doing work around strategy. So our students work in strategy, we work in strategy, and we've been working closely with government to design a system that creates the right kind of incentives for providers, whether in a public space or a private space, in order to provide better care, more care, higher quality care. One of the advantages we have at Rotman is we are in the healthcare capital of Canada and one of the major cities for healthcare in the world. So what we're able to take advantage of is the industry resources, whether it's hospital CEOs who sit on my advisory board or presidents and CEOs of our pharmaceutical firms or medical device firms. And they were also on our advisory board, as is the deputy minister, who happens to be responsible for spending $50 billion of healthcare dollars every year, and he works closely with us. So we have a tremendous advisory who are committed to helping us redesign the curriculum as needed, but also helping us think about how to best place our students. So we work really hard in placing our students, because if we don't do that, we're not successful. We try to connect our students in the field while they're here during the program. So they work on consulting projects with trained consultants. They're in the field. It's not unusual for a student to finish a semester course that's a field-based project supervised by a consultant, and then have that client offer the student, or in one case, a team of students, permanent positions after their MBA. So one of the things that's really important is students understand that healthcare is a different kind of industry. It's a massive industry. It's an industry that will always grow in demand, but they do need to make a commitment. So we offer a slate of courses during the second year. We also offer independent studies and advising. But once a student has decided this is what I want to do, or at least this is what I want to consider doing, we can get them that exposure, but they have to show an interest. There's nothing a faculty member likes more than a student who says, I'm really interested in the work you're doing. Can you help me go deeper into the industry? And every one of us will say, absolutely.